economy and a win for New Zealand. Thank you, Mr. Speaker.
Honourable Annie King.
Mr. Speaker, can I begin by also thanking the Business Committee for agreeing to this historic debate, but also a historic report, because in my time in Parliament I have not seen a report that has had the agreement of all parties that sat on that inquiry. And it has come about by us coming together with a lot of consensus, concern and common sense, both economic common sense and social common sense. And I think it's come about because we accept that here in New Zealand we really have reached a crisis point when it comes to the future of our very young children. And it's timely also that we have our leaders over in South Africa attending the funeral of Nelson Mandela. And one of the things that he said in very recent years was this: we cannot waste our precious children, not another one, not another day. It's long past time for us to act on their behalf. And what I think that this report is doing is saying it is time for us across this Parliament to act on behalf of the very youngest and most vulnerable in our society. I want to thank Dr. Paul Hutchison for leading as chair of this inquiry in a very able way. I have found him to be a very compassionate man, and he will be leaving a legacy for future governments with this report. And I can tell Dr. Hutchison I look forward to implementing it after the election next year. I also commend the members of the committee. The stories of politicians that all we do is bicker and fight can be dispelled by the work that went into this inquiry. It is about improving child health outcomes with a focus, as Dr. Hutchison said, on preconception through to 3 years of age. And it came about after many, many submissions, many discussions and a lot of expert advice. And so the result of all that work is a report based on the best scientific evidence available, both here in New Zealand and internationally. In fact, I believe that Professor Sir Peter Gluckman would be very proud of the work that we've done, because this is an evidence-based inquiry and report. And what it recommends is that the government, any government in the future, put more focus on and investment into children from preconception through to 3 years of age. And as it states, it's a policy that is backed by science, by equity and by ethics, as well as good, sound economic sense. And Mr. Speaker, the evidence is very strong that we ought to be investing into these very early years. It's fundamentally important to a child's health outcomes. We also know there can be great gains and cost saving if we as a country are prepared to invest into effective evidence-based early intervention. And Dr. Hutchison mentioned James Heckman. He was a man who's done a lot of groundbreaking work in the quality of early childhood development, which has proved that there is great economic gains by investment into those very early years. And I like this quote from him. He said, "The real question is how to use the available funds wisely. The best policy prescription, invest in the very young and improve basic learning and socialisation skills." Mr. Speaker, there are 12 major recommendations and we can't go into them all today. But I would like to just mention quickly 2 very important ones: the need for leadership and an integrated children's action plan. This recommendation in the report says the Prime Minister ought to accept the formal role of developing and implementing a whole-of-government interagency action plan. and it would also include monitoring outcomes and annual or biannual reporting of progress, and that there was a need to have a cross-party approach on the key recommendations. That, I have to say, was one of the things that was in our children's policy at the last election: a Minister for Children, a Ministry for Children, and a priority on an action plan. This has been accepted in this, and I look forward for you seeing it in our policy again at the next election. And the last thing I'd like to say is a recommendation to address the social and economic determinants of health and well-being. Very important to address the disadvantage many of our children in New Zealand face. Thank you, Mr. Speaker, for this opportunity to support a very good inquiry.
Dr. John Yang.
Mr. Speaker, it is a great privilege to speak on the report about inquiry into improving child health outcomes and preventing child abuse with a focus from preconception until 3 years of age. I would like to first commend Dr. Paul Hutchison, Chair of the committee, for his outstanding leadership in the conduct of this inquiry. Dr. Hutchison demonstrated his extensive knowledge of the New Zealand health system and his unfailing commitment to the inquiry. Without his leadership, knowledge and commitment, we would not have been able to produce such a high-quality and far-reaching report. Mr. Speaker, this is the very first inquiry that I have participated in as an MP. I have learned a lot. There were 4 doctors on the committee initially, including Dr. Paul Hutchison, Dr. Jackie Blue, Dr. Cam Kilda, and Dr. Jan Yang myself. Dr. Paul Hutchison used to say that I was the real doctor, but the fact is the other 3 doctors are genuine medical doctors.